AFib Explained: Symptoms, Causes, and Treatment. Welcome to the U.S. Health Guide, your trusted source for clear, concise, and scientifically accurate health information. Today, we delve into a common yet often misunderstood heart condition: atrial fibrillation. Opening, hook, and introduction to AFib. The sensation of a racing or fluttering heart is a common experience for many. While a skipped beat might be fleeting, a more persistent and chaotic heart rhythm can signal a significant underlying condition. This phenomenon is known as atrial fibrillation, or AFib, which stands as the most common type of treated heart arrhythmia, affecting millions across the United States. An arrhythmia broadly refers to an irregular heartbeat, but AFib is specifically characterized by a very rapid and often highly irregular heart rhythm. At the core of AFib, the heart's two upper chambers, known as the atria, fail to contract properly. Instead, they beat chaotically and too fast, appearing to quiver rather than delivering a coordinated pump. This fundamental disruption interferes with the normal, synchronized flow of electrical signals that orchestrate a healthy heartbeat. Understanding AFib is the first step toward managing its impact. This report aims to demystify AFib by exploring its symptoms, identifying its causes, and detailing the crucial treatments available to manage the condition and prevent its serious complications. Many individuals with AFib experience no symptoms at all, remaining unaware of their condition. This asymptomatic presentation poses a significant challenge for early detection, as individuals may not seek medical attention until serious complications manifest. Given that millions in the U.S. are affected by AFib, with its prevalence increasing with age, the silent nature of the condition highlights a considerable public health challenge. It underscores the profound importance of public awareness campaigns and potentially opportunistic screening, particularly within at-risk populations. This broader context emphasizes the critical role of understanding risk factors, even in the absence of overt symptoms, and the value of regular health checkups, especially as individuals age. Understanding AFib, the heart's electrical symphony. To comprehend AFib, it is essential to first understand the mechanics of a healthy heart. A healthy heart functions like a perfectly synchronized orchestra, where each beat is meticulously coordinated by precise electrical signals. This process begins with a tiny natural pacemaker, the sinus node, located in the upper right chamber of the heart. The sinus node emits a precise electrical signal that travels through both upper chambers, the atria, causing them to contract and efficiently push blood into the lower chambers, the ventricles. Following this, the signal briefly pauses at the atrioventricular AV node, which acts as a crucial gatekeeper. This pause allows the ventricles to fully fill with blood before they receive the signal to contract and pump blood to the body and lungs. This coordinated sequence results in a steady, regular heart rate, typically ranging from 2 beats per minute at rest. In AFib, this intricate system descends into disarray. Instead of a single, coordinated signal, numerous disorganized electrical impulses fire from various locations within the atria, causing them to quiver inefficiently rather than contract properly. The atrioventricular AV node, acting as a crucial gatekeeper, becomes overwhelmed by this deluge of chaotic signals and cannot prevent all of them from reaching the lower chambers. Consequently, the ventricles begin to beat too rapidly and irregularly, often ranging from various beats per minute, far exceeding the normal resting rate. This rapid, uncoordinated ventricular beating means the heart's lower chambers do not have sufficient time to adequately fill with blood before contracting. This directly compromises the heart's ability to pump sufficient oxygen-rich blood to the body, leading to diminished blood flow and, over time, potentially contributing to heart failure. Furthermore, the inefficient atrial contraction allows blood to pool in the upper chambers, a phenomenon that significantly increases the risk of blood clot formation. Recognizing the signs, symptoms of AFib. The presentation of AFib can vary significantly among individuals. A notable proportion of people, surprisingly, experience no symptoms at all, remaining unaware that they have the condition. This asymptomatic nature underscores why understanding personal risk factors is critically important. For those who do experience symptoms, they can manifest as a range of sensations and physical changes. These include palpitations, often described as a feeling of a fast, fluttering, pounding, or skipped heartbeat within the chest, arising directly from the erratic and rapid contractions of both the atria and ventricles. Individuals may also experience shortness of breath, particularly during physical exertion or when lying down, which occurs because the heart's inefficient pumping can cause blood to back up into the pulmonary veins, leading to fluid accumulation in the lungs. Many report unusual and profound tiredness, or a general feeling of physical weakness, a symptom stemming from the heart's inability to pump enough oxygen-rich blood to adequately supply the body's tissues and the brain. Lightheadedness or dizziness, where individuals may feel faint, unsteady, or experience a sensation of spinning, is also a direct consequence of reduced blood flow to the brain. Discomfort or a feeling of pressure in the chest area can also be a symptom. AFib episodes can also be categorized by their duration and persistence. Some individuals experience occasional or paroxysmal AFib, where symptoms come and go, typically lasting from a few minutes to several hours, though sometimes up to a week. These episodes may resolve on their own, but some individuals still require treatment. In persistent AFib, the irregular heartbeat is constant and does not reset spontaneously, necessitating medical intervention to correct the rhythm. Long-standing persistent AFib is characterized by a constant irregular rhythm lasting longer than months, requiring medication or a procedure. Finally, permanent AFib signifies that the irregular heart rhythm cannot be reset, making ongoing medication essential for heart rate control and blood clot prevention. The symptoms experienced by individuals with AFib are not merely discomforts. They are direct manifestations of the underlying physiological dysfunctions that can lead to severe complications. For instance, shortness of breath and fatigue arise because the heart's inefficient pumping can cause blood to accumulate in the pulmonary veins, leading to fluid buildup in the lungs. This inadequate systemic perfusion serves as an early indicator of potential heart failure, one of AFib's serious consequences. Similarly, the erratic heartbeat and the pooling of blood within the atria are direct precursors to the formation of blood clots, which can then travel to the brain and cause a stroke. Understanding these connections elevates the importance of recognizing even seemingly mild symptoms, as they reflect underlying physiological issues that demand prompt medical attention to prevent life-threatening conditions. Unraveling the roots, causes, and risk factors. Atrial fibrillation most frequently originates from structural changes within the heart's tissue or disruptions to its intricate electrical signaling system. This damage often stems from other pre-existing health conditions. A comprehensive understanding of these underlying factors is crucial for both prevention and management. Several key factors significantly increase an individual's likelihood of developing AFib. Age is a primary factor, as the risk of AFib escalates notably with advancing age, particularly after years, playing a significant role in the increasing prevalence of the condition. High blood pressure, hypertension, is a leading contributor to AFib, accounting for a substantial percentage of cases, estimated between percent and percent. Prolonged, uncontrolled high blood pressure can cause parts of the heart to become stiff and thickened, altering the pathways through which electrical signals travel. A broad category of underlying heart conditions significantly predisposes individuals to AFib. These include coronary artery disease, narrowed or blocked arteries, heart valve disease, which can lead to atrial enlargement, a history of heart attack or heart surgery, congenital heart defects, problems present at birth, sick sinus syndrome, a malfunction of the heart's natural pacemaker, and pre-existing heart failure. A number of other chronic health conditions are strongly linked to AFib. Obstructive sleep apnea shows a significant correlation, and treating sleep apnea often leads to improvements in AFib. Obesity, particularly higher body mass index (BMI), directly correlates with an elevated risk of developing AFib, with even a % reduction in body weight potentially lowering this risk. Both prediabetes and established diabetes are associated with a significantly increased risk of AFib. An overactive thyroid disease, hyperthyroidism, can directly raise the risk of irregular heartbeats. Conditions such as pneumonia and chronic obstructive pulmonary disease, COPD, can contribute to AFib, falling under lung diseases. The risk of AFib increases proportionally with the severity of chronic kidney disease. Certain lifestyle habits can act as triggers or exacerbate existing AFib. Excessive alcohol consumption, particularly binge drinking, can directly affect the heart's electrical signals, and for some individuals, even modest amounts of alcohol can trigger an AFib episode. Smoking, tobacco use increases AFib risk, and conversely, cessation of tobacco use can significantly lower this risk. Illegal drug use, stimulants like amphetamines and cocaine, and even certain over-the-counter cold and allergy medicines containing stimulants can induce or worsen arrhythmias. Emotional stress, including panic disorders, has been linked to a higher risk of AFib. Genetics, family history also plays a role, as a family history of AFib increases an individual's predisposition, with specific gene mutations identified in some cases. Finally, mineral imbalances in electrolytes such as potassium, sodium, calcium, and magnesium, which are vital for proper heart function, can lead to irregular heartbeats if their levels are too low or too high. The extensive array of risk factors associated with AFib reveals that the condition is often not an isolated cardiac issue, but rather a manifestation or complication of broader systemic health challenges. Conditions such as high blood pressure, diabetes, obesity, sleep apnea, chronic kidney disease, thyroid disorders, and lung conditions are frequently linked to the development of AFib. These are predominantly chronic conditions that necessitate long-term management and often benefit significantly from lifestyle interventions. This interconnectedness implies that effective prevention and management of AFib require a holistic approach to overall health. For example, diligent control of blood sugar levels, maintaining a healthy weight, managing blood pressure, and addressing sleep apnea are not merely general health recommendations. They represent direct and powerful interventions for reducing AFib risk and alleviating its burden. This perspective shifts the focus from solely treating AFib symptoms to emphasizing proactive lifestyle modifications and meticulous management of coexisting medical conditions as foundational preventive strategies. It underscores that human physiology functions as a complex, integrated system where imbalances in one area can profoundly affect others. While general health advice often champions certain habits, the relationship between AFib and factors like caffeine consumption or exercise can be more nuanced, necessitating personalized guidance. For example, while normal amounts of caffeine typically do not increase the risk of AFib in the general population, individuals already diagnosed with the condition may find that even modest caffeine intake can trigger a racing heart. Similarly, while moderate physical activity is widely recognized as protective against heart disease, including AFib, highly strenuous endurance training, particularly in competitive athletes, has been observed to potentially increase AFib risk in some individuals. This complexity highlights that universal health recommendations may require careful adjustment for individuals with specific pre-existing conditions like AFib. Consequently, consulting a healthcare professional for tailored advice becomes paramount, ensuring that lifestyle choices align with an individual's unique health profile. The stakes, potential complications of AFib. While atrial fibrillation itself is not typically immediately life-threatening, it is a serious medical condition that demands proper treatment due to its significant potential for severe complications. Understanding these risks is crucial for appreciating the importance of effective management. Among the potential complications of AFib, stroke stands out as the most critical and frequently emphasized concern across medical literature. AFib increases an individual's risk of stroke by approximately 4 to 5 times compared to those without the condition. And these strokes tend to be more severe. often resulting in permanent disability or death. This heightened risk is rooted in the physiological disruption caused by AFib. When the atria quiver inefficiently, blood can pool within these upper heart chambers. Stagnant blood is highly prone to forming clots. If a blood clot forms in the heart and subsequently travels to the brain, it can block the blood supply to an artery, leading to an ischemic stroke. The consistent emphasis on proper treatment to prevent stroke and the common prescription of blood thinners specifically for this purpose indicates that stroke prevention is frequently the paramount clinical objective in AFib management, even superseding immediate rhythm control for many patients. This prioritization implies that for numerous individuals, particularly older adults, or those with additional stroke risk factors, anticoagulation therapy may represent the single most vital component of their treatment plan, irrespective of whether they experience other AFib symptoms or if their heart rate is otherwise controlled. This understanding underscores the critical importance of a thorough physician's risk assessment to determine the necessity of blood-thinning medications, even in cases where other AFib symptoms are mild or absent. Beyond stroke, AFib can also lead to or worsen heart failure. This occurs because when the heart beats too rapidly or unevenly due to the chaotic signals of AFib, its chambers do not have enough time to properly fill with blood before attempting to pump it out. This inefficient pumping means the heart struggles to meet the body's demands for oxygenated blood. Consequently, blood can back up into the pulmonary veins, leading to fluid accumulation in the lungs, which manifests as increased fatigue and shortness of breath. Fluid retention can also become evident in the feet, ankles, and legs. Furthermore, the pervasive disruption to the heart's electrical system caused by AFib can contribute to the development of other heart rhythm or rate problems. Taking control, treatment and management strategies. The management of atrial fibrillation is centered on several key objectives: resetting and controlling the heart's rhythm, alleviating symptoms, and most critically, preventing the formation of dangerous blood clots and subsequent stroke. Treatment plans are highly individualized, tailored to factors such as the duration of AFib, the severity of symptoms, and the individual's overall health status. Medical approaches form a cornerstone of AFib management. Medications are a primary tool, including rate control medicines such as beta blockers, calcium channel blockers, and digoxin, prescribed to slow down the heart rate and prevent the ventricles from beating excessively fast. Rhythm control medicines, also known as antiarrhythmics, aim to restore and maintain a normal, regular heart rhythm, though their use is often carefully considered due to potential side effects. Blood thinners, anticoagulants, are perhaps the most vital medications for AFib patients. Drugs like warfarin or newer direct oral anticoagulants, DOACs, such as apixaban, dabigatran, edoxaban, and rivaroxaban, are prescribed to prevent blood clots from forming in the heart, thereby significantly reducing the risk of stroke. Individuals taking warfarin require regular blood tests to monitor its effects. When medications alone are insufficient or not the preferred option, various procedural interventions can be considered. Electrical cardioversion involves delivering small electrical shocks to the heart's exterior through paddles or patches while the patient is under mild anesthesia, aiming to reset the heart's normal rhythm. If blood clots are suspected, blood thinners may be administered before and after this procedure. Catheter ablation is a minimally invasive procedure that involves destroying or scarring tiny areas of heart tissue responsible for sending out the faulty electrical signals causing AFib. A thin, flexible tube, or catheter, is guided through a blood vessel into the heart, where heat or cold energy is applied to create the necessary scars. Common types include pulmonary vein isolation, PVI, ablation, and AV node ablation, the latter often necessitating a permanent pacemaker afterward. While ablation can significantly reduce symptoms, AFib can recur, sometimes requiring repeat procedures. For individuals who cannot safely take blood thinners due to a high risk of bleeding, left atrial appendage closure, a procedure to seal off the left atrial appendage, a small sac in the heart, where most AFib-related clots tend to form, may be an option. The maze procedure is a surgical option, often performed concurrently with other necessary heart surgeries, involving creating a pattern of scar tissue within the upper chambers of the heart to block chaotic electrical signals. The management of AFib is rarely confined to a single intervention. Rather, it typically involves a synergistic combination of medical therapies, procedural interventions, and diligent lifestyle modifications. Medical literature consistently describes diverse treatment types, including medications for rate and rhythm control, blood thinners, and procedures such as cardioversion and catheter ablation. This multifaceted approach suggests that no singular magic bullet exists for AFib. Instead, the most effective management often integrates these various modalities. For instance, medications help regulate heart rate and rhythm, while blood thinners directly address the critical risk of stroke. Concurrently, lifestyle adjustments support overall cardiovascular health and can significantly reduce the burden of AFib and its associated risk factors. Even after procedural interventions like ablation, which may restore normal rhythm, ongoing medication and adherence to healthy lifestyle habits are frequently necessary. This comprehensive perspective empowers individuals to recognize their active role in managing the condition beyond merely adhering to prescribed medications. It highlights that consistent commitment to all facets of the treatment plan, both medical and lifestyle, is paramount for achieving long-term success and mitigating the risk of recurrence or progression, reflecting the often chronic nature of AFib for many individuals. Beyond medical and procedural interventions, healthy lifestyle choices represent a vital component of both preventing AFib and effectively managing it once diagnosed. A heart-healthy diet emphasizes a diet rich in fruits, vegetables, and whole grains, while limiting intake of salt, saturated fats, and sugar. For those on warfarin, maintaining a consistent intake of vitamin K-rich foods, rather than avoiding them, is advised to ensure stable medication effectiveness. Regular physical activity, aiming for at least minutes of moderate physical activity on most days of the week, as advised by a healthcare professional, is crucial. Maintaining a healthy weight is important, as being overweight significantly increases AFib risk, and losing excess weight can substantially reduce this risk. Diligent management of coexisting conditions, such as high blood pressure, high cholesterol, and diabetes is crucial for controlling underlying conditions. To avoid triggers, individuals should limit or completely avoid excessive alcohol consumption and refrain from smoking or using any tobacco products. Additionally, avoiding illegal drugs and stimulants is advised. Implementing healthy coping mechanisms to reduce and manage stress is also beneficial. Finally, prioritizing good sleep, aiming for 2 hours of quality sleep daily, is important, as poor sleep habits can elevate the risk of heart disease and other chronic conditions, and if sleep apnea is present, it should be properly addressed. Call to action and conclusion. Understanding atrial fibrillation is the foundational step towards effectively managing this condition and mitigating its risks. The persistent emphasis on proper treatment to prevent stroke and the often chronic nature of AFib, which can manifest as occasional, persistent, long-standing, persistent, or permanent, collectively highlight the profound importance of early intervention and continuous management. While initial treatments like cardioversion and ablation can be highly effective, the potential for AFib recurrence means that ongoing vigilance is frequently necessary. This understanding implies that recognizing initial symptoms and seeking prompt medical consultation are not merely steps towards immediate symptom relief, but rather crucial actions for initiating a long-term management strategy aimed at preventing severe, irreversible complications such as stroke. Furthermore, it underscores that even after initial therapeutic success, sustained monitoring and unwavering adherence to prescribed therapies and recommended lifestyle changes are essential for maintaining cardiovascular health and preventing the condition's recurrence or progression. This perspective reinforces the critical call to action, framing health management not as a one-time fix, but as an enduring partnership with healthcare providers for sustained well-being. If any of the symptoms discussed are experienced, or if there are known risk factors for AFib, it is imperative to schedule a health checkup and discuss these concerns with a healthcare professional. Self-diagnosis is not recommended. With proper diagnosis, tailored treatment plans, and proactive lifestyle management, many individuals living with AFib can lead full, active, and healthy lives. Taking control of one's health is paramount in navigating this condition successfully.